അല്ലേ? പിന്നെ ഡോക്ടറെ തുടങ്ങല്ലേ?
Sure. Ready.
പ്രിയപ്പെട്ട എല്ലാ അഷ്ടാംഗം സഹപ്രവർത്തകർക്കും പാക്ടോ അംഗങ്ങൾക്കും എൻ്റെ വിനീതമായ നമസ്കാരം. കൊറോണ ബാധിച്ചതിന് ശേഷം ക്യാമ്പസുകളെല്ലാം തികച്ചും നിർജീവവും നിശ്ചലവുമായിരിക്കുന്ന സാഹചര്യത്തിൽ അധ്യാപകരുടെ ഒരു ക്രിയേറ്റിവിറ്റി വർദ്ധിപ്പിക്കുന്നതിനും അവരുടെ ചിന്താ സരണികളെ കൂടുതൽ നന്നാക്കുന്നതിനും ഉദ്ദേശിച്ചുകൊണ്ട് ഗുരുമുഖം എന്ന സീരീസ് അഷ്ടാംഗം ആയുർവേദ വിദ്യാപീഠം ഏകദേശം 1 മാസം മുമ്പ് ആരംഭിക്കുകയുണ്ടായി. ജൂൺ 11 അത് ഉദ്ഘാടനം ചെയ്തത് കൃഷ്ണകുമാർജിയാണ്. ആദ്യത്തെ ക്ലാസ് കൃഷ്ണകുമാർജിയുടെ ആയിരുന്നു. പിന്നത്തെ വ്യാഴാഴ്ച ഡോക്ടർ അന്റോണിയോ മൊറാൻഡി ടൈംലെസ് മെഡിസിൻ, ആയുർവേദ ദ ടൈംലെസ് മെഡിസിൻ എന്ന വിഷയത്തെ പറ്റി 2ാമത്തെ ഗുരുമുഖം നടത്തി. 3ാമത് ഡോക്ടർ ശ്രീനിവാസ് ആചാര്യ, SDM ആയുർവേദ കൂടെ ഉടുപ്പിയിലെ പ്രിൻസിപ്പളായ ഡോക്ടർ ശ്രീനിവാസ് ആചാര്യ ഒരു ക്ലിനിഷ്യൻ ആവേണ്ടതിന്റെ ആവശ്യകത, ഒരു ക്ലിനിഷ്യന്റെ ശ്രദ്ധ തുടങ്ങിയ വിഷയങ്ങളെ പറ്റി സംസാരിച്ചു. അങ്ങനെ ഇന്ന് നമ്മുടെ ഗുരുമുഖം സീരീസിലെ 4ാമത്തെ പ്രബന്ധമാണ്, അല്ലെങ്കിൽ പ്രസക്തമായ വിഷയമാണ് പ്രാതിനൈമിക സിദ്ധി അഥവാ ക്ലിനിക്കൽ പ്രാക്ടീസ് സക്സസ് എന്ന് പറഞ്ഞാൽ എന്താണ് ഉദ്ദേശിക്കുന്നത് എന്ന്. ഇന്ന് നമ്മളോടൊക്കെ സംസാരിക്കാൻ പോകുന്നത് ഡോക്ടർ പി രാമമനോഹർ ആണ്. ഒരുപക്ഷെ കേരളത്തിലെ അധ്യാപകന്മാർക്ക് പരിചയപ്പെടുത്തേണ്ട ആവശ്യമില്ലാത്തൊരു വ്യക്തി കൂടിയാണ് ഡോക്ടർ പി രാമമനോഹർ. കാരണം പലതാണ്. കാരണം കേരളത്തിൽ നടക്കുന്ന മിക്കവാറും എല്ലാ സെമിനാറുകളിലും രാമമനോഹർ സാറിന്റെ പ്രബന്ധങ്ങള് വളരെ വ്യത്യസ്തമായ വിഷയങ്ങളിൽ സംസാരിക്കുന്ന സംസ്കൃതം, പദാർത്ഥ വിജ്ഞാനം, ദ്രവ്യഗുണം തുടങ്ങി റിസർച്ച് വരെയുള്ള ഒരു വൈവിധ്യമായ മേഖലകൾ ഒരേ സമയം കൈകാര്യം ചെയ്യാൻ കഴിവുള്ള ഒരു ബൃഹത്തായിട്ടുള്ള ഇന്റലിജൻസിന് മാത്രം ചെയ്യാവുന്ന വൈവിധ്യമായ മേഖലയെ ഒരേ സമയം കൊണ്ടു നടക്കുന്ന അപൂർവം വ്യക്തികളിൽ ഒരാളാണ് ഡോക്ടർ പി രാമമനോഹർ. പലപ്പോഴും നമ്മളൊക്കെ ഏതെങ്കിലും ഒരു ഡിപ്പാർട്ട്മെന്റിൽ വർക്ക് ചെയ്യുമ്പോൾ ആ ഡിപ്പാർട്ട്മെന്റിലെ വിഷയങ്ങൾ മാത്രം അത് വളരെ ആഴത്തിൽ മനസ്സിലാക്കുകയും മറ്റുള്ള ഡിപ്പാർട്ട്മെന്റുകളെ തമ്മിൽ നമ്മൾ അത്ര മനസ്സിലാക്കപ്പെടാതെ പോവുകയും ചെയ്യും. പക്ഷെ രാമമനോഹർ സാറിന്റെ ഒരു പ്രത്യേകത, അദ്ദേഹം കൈവയ്ക്കാത്ത മേഖലകൾ വളരെ കുറവാണ് എന്നുള്ളതാണ്. പദാർത്ഥ വിജ്ഞാനമായിക്കോട്ടെ, അല്ലെങ്കിൽ മൗലിക സിദ്ധാന്തമായിക്കോട്ടെ, വൈവിധ്യമായിട്ടുള്ള മേഖലകൾ ഒരേ സമയം തൻ്റെ ഇന്റലിജൻസിന് അതൊക്കെ വഴങ്ങും എന്ന് ലേഖനങ്ങളിൽ കൂടെയും പ്രസംഗങ്ങളിൽ കൂടെയും ഒക്കെ തെളിയിച്ചൊരു വ്യക്തിത്വമാണ്. അപ്പൊ അതുകൊണ്ട് തന്നെ ഒരു അധ്യാപകന്റെ സാധ്യതകൾ ഒരു കോയമ്പത്തൂർ പ്രോഡക്റ്റ് എന്ന നിലയിൽ, അല്ലെങ്കിൽ കൊപ്പ കോളേജിൽ ഉണ്ടായിരുന്ന കാലം മുതൽ, അല്ലെങ്കിൽ കഴിഞ്ഞൊരു 25-30 വർഷത്തെ അദ്ദേഹത്തിന്റെ ഒരു നിരീക്ഷണം നമ്മളെ പോലുള്ള അധ്യാപകർക്ക് തീർച്ചയായിട്ടും വളരെ അധികം അതായത് ഉത്സാഹം തരുന്നതും അല്ലെങ്കിൽ ഉന്മേഷം തരുന്നതും എന്ന കാര്യത്തിൽ സംശയമില്ല. അത് മാത്രമല്ല, അദ്ദേഹത്തിന്റെ ഒരു ഇന്റർനാഷണൽ ഫേസ് എന്ന് പറയുന്നത് വളരെ വലുതാണ്. എനിക്ക് വളരെ വ്യക്തിപരമായിട്ട് അറിയാവുന്നത് കൊണ്ട് പറയാണ്. ഒരുപക്ഷെ ഇന്ത്യയിൽ നിന്ന് ഏതൊരു കോൺഫറൻസിനും ആയുർവേദത്തിനെ പ്രതിനിധീകരിച്ച് വിളിക്കാവുന്ന 2-3 പേരുകൾ ഉണ്ടെങ്കിൽ അതിലൊന്ന് ഡോക്ടർ പി രാമമനോഹറിന്റെ പേരായിരിക്കും. അപ്പൊ ഓരോ രാജ്യത്തിലും എനിക്ക് തോന്നുന്നത് ഒരു 20-30 രാജ്യങ്ങളിൽ ഒരുപക്ഷെ അദ്ദേഹം നേരിട്ട് പോയി ആയുർവേദത്തിനെ പ്രതിനിധാനം ചെയ്യുന്നുണ്ടാവും. 25-30 വയസ്സിൽ, എന്റെ ഓർമ്മ ശരിയാണെങ്കിൽ ഒരു 25-30 വയസ്സിൽ തന്നെ ലണ്ടനിലെ വെൽക്കം ഇൻസ്റ്റിറ്റ്യൂട്ടിൽ പോയി സംസാരിച്ചിട്ടുണ്ട് അദ്ദേഹം. ഇങ്ങനെ ഒരു ആയുർവേദത്തിന്റെ വലിയൊരു വക്താവിനെയാണ് നമുക്ക് ഇന്ന് നമ്മുടെ മുമ്പിൽ ഉള്ളത് എന്നുള്ളത് അഷ്ടാംഗം ആയുർവേദ കോളേജിനെ സംബന്ധിച്ചിടത്തോളം, അതുപോലെ തന്നെ പാക്ടോ അംഗങ്ങളെ സംബന്ധിച്ചിടത്തോളം വലിയൊരു അഭിമാനപൂർവമായിട്ടുള്ള ഒരു നിമിഷമാണ്. ഞാൻ എന്തായാലും കൂടുതൽ ദീർഘിപ്പിക്കുന്നില്ല. ഞാൻ അഷ്ടാംഗത്തിന്റെ പേരിലും പാക്ടോന്റെ പേരിലും ആദ്യമായി ഡോക്ടർ പി രാമമനോഹറിനെ ഈ പ്രോഗ്രാമിലേക്ക് വളരെയധികം സന്തോഷപൂർവ്വം സ്വാഗതം ചെയ്യുന്നു. വൈകിയ വേളയിൽ കൂടുതൽ ദീർഘിപ്പിക്കുന്നില്ല എങ്കിൽ കൂടിയും ഒരു ഫെലിസിറ്റേഷൻ അഡ്രസ്സിന് നങ്ങേലിൽ ആയുർവേദ കോളേജിലെ വൈസ് പ്രിൻസിപ്പാളും നമ്മുടെ സുഹൃത്തുമായ ഡോക്ടർ ബിനോയോട് ഫെലിസിറ്റേഷൻ അഡ്രസ്സിനായി ആവശ്യപ്പെടുന്നു. ഡോക്ടർ പ്ലീസ്.
ഹലോ ഹലോ, കേൾക്കാൻ പറ്റുമോ അല്ലേ? ഹലോ, ഗുഡ് ഈവനിങ് സർ. ഞാൻ ഡോക്ടർ ബിനോയ്, നമ്മൾ അമൃതയിൽ വന്നപ്പോൾ കണ്ടിട്ടുണ്ട്, പരിചയപ്പെട്ടിട്ടുണ്ട്. സാറിന്റെ ഒരു ക്ലാസ് അറ്റൻഡ് ചെയ്യാൻ ഒരു സാഹചര്യം ലഭിച്ചതിൽ ഞങ്ങൾക്ക് സന്തോഷമുണ്ട്, വളരെയധികം സന്തോഷമുണ്ട്. ഒത്തിരി വിദ്യാർത്ഥികൾ പറഞ്ഞും എല്ലാം അതിലൂടെ കേട്ടിട്ടേ ഉള്ളൂ, സാറിന്റെ ക്ലാസ്സിൽ ഇരിക്കാൻ സാധിച്ചിട്ടില്ല. ഇന്ന് അതൊരു സാഹചര്യം ലഭിച്ചു. അതിന് ഫാക്ടോയോടും അതേപോലെ അഷ്ടാംഗം ആയുർവേദ കോളേജിനോടുമുള്ള ആ ഒരു നന്ദി ഞാൻ ആദ്യം രേഖപ്പെടുത്തട്ടെ. ഇങ്ങനെ നല്ലൊരു സംരംഭം നമുക്ക് വേണ്ടി അറേഞ്ച് ചെയ്തതിന് ഞാൻ അഭിനന്ദനങ്ങൾ അർപ്പിക്കുകയാണ്. പ്രത്യേകിച്ച് ഒരു അധ്യാപകൻ എങ്ങനെയാണ് വിദ്യാർത്ഥികളെ പഠിപ്പിക്കേണ്ടത് എന്നുള്ളത് അത് വളരെ പ്രധാനപ്പെട്ടാണ്. പ്രത്യേകിച്ചും അതൊരു മെഡിക്കൽ ഫീൽഡിലെ അധ്യാപകരാകുമ്പോൾ. കാരണം രണ്ട് ഭാഗങ്ങളാണ്, ഒന്ന് അധ്യാപനം എന്നുള്ളതും രണ്ട് മെഡിക്കൽ പ്രൊഫഷൻ എന്നുള്ളതും. ഇത് രണ്ടിനെയും ഒരേപോലെ ഓർത്തിണക്കി കൊണ്ടുപോകുന്നത് ആ ഒരു കഴിവ് നമ്മൾക്ക് മാത്രമാണ് ഉള്ളതെന്നുള്ളതാണ്. എന്ന് വെച്ച് നമുക്ക് പോരായ്മകൾ ഇല്ല എന്നല്ല. ആ പോരായ്മകളെ നികത്തുവാൻ വേണ്ടിയിട്ട് സാറിന്റെ ഒരു ഉപദേശം എല്ലാ അധ്യാപകർക്കും ഒരു വഴികാട്ടിയാവട്ടെ ഞാൻ പ്രാർത്ഥിക്കുകയാണ്. അതേപോലെ വീണ്ടും മികച്ച ഈ ഒരു കോവിഡ് സമയത്ത് നമ്മളുടെ ഈ ഒരു പല രീതിയിലുള്ള തടസ്സങ്ങളെ അതിജീവിച്ചുകൊണ്ട് നമ്മുടെ വിദ്യാർത്ഥികളിലേക്ക് നല്ല ആശയങ്ങളെയും അതേപോലെ ശാസ്ത്രഭാഗങ്ങളെയും എത്തിക്കുവാൻ ഈ ഒരു സെഷൻ ഉപകരിക്കട്ടെ എന്ന് പ്രാർത്ഥിക്കുന്നു. നന്ദി. ഹലോ,
തുടങ്ങാമോ? ഹലോ, കേൾക്കാവോ? തുടങ്ങാം. നമസ്കാരം. ഫസ്റ്റ് ഓഫ് ഓൾ, okay, thank you. Namaskaram. First of all, thank you very much for the warm introduction and kind words. I'm overwhelmed by this welcome, and I'd like to congratulate the organizers, Ashtangam Ayurveda and Pacto, for taking such initiatives during the stressful period of the COVID pandemic. It's really important that we maintain, the intellectual engagement with our science, and even as Ayurveda is also beginning to, engage itself in meeting the challenges of this COVID pandemic, I think it's even more important that we all are well prepared. Today, we are going to discuss on a topic which I think is very relevant from a clinical practice point of view, and also from the point of view of the education of young Ayurveda students. The topic is, as Dr. Nambi already mentioned, the focus is on what do we mean by success in clinical practice. And I am using a term that is found in the Charaka Samhita. This term has been coined by the celebrated commentator of Charaka Samhita, and this is called as Pratiniyamiki Siddhi. I will just share my screen in a moment. So I'd like to also point out, I came to study Ayurveda because my father was very keen that I should study Ayurveda. I must admit that I was a bit annoyed that I was not given a chance to appear for the entrance and try for modern medicine. I wanted to study modern medicine when I was very young, but because of the Gurukula system that Krishna Kumarji had set up in Coimbatore, my father was very fascinated and wanted me to go and study there. And I still remember in the beginning it was very difficult for me. I did not have much faith in Ayurveda, and there was many times which during the course also I went through a lot of frustrations and wanted to really know whether Ayurveda really works and in what way it can be helpful. So I must say that this particular topic has caught my attention also from this background. And what I'm going to share with you today are some of the insights that I gained even while I was a student, as I was reading through the commentaries and the classical texts. So I want to start our discussion today. I will just start sharing the slide in a moment. So I need my screen sharing to be enabled.
Raman sir, can you make him host? Yeah, so already done. Okay.
Okay, now fine. It's okay. So are you able to now see the screen? Is it clear?
Yes, it is clear.
Okay, thank you. So then we will get started. So as I said, the topic today is Pratinimiki Siddhi. And this has been a very fascinating journey for me in understanding, the rigor, the intellectual rigor in the classical tradition of Ayurveda. And I must say that these are passages in the text which I find most of us sometimes do not give much attention to. And I have not found these aspects being also discussed in much detail within the Ayurvedic community, and which is one of the reasons why I thought we will take this up for discussion. So let's begin by asking this question: how do we define success in clinical practice? I mean, you might be wondering what's a big deal about this? I mean, it's very simple. When we prescribe a medicine to a patient who comes to us for consultation, and if the patient gets better, I mean, that's it. I mean, this is clinical success. So if there is a marked improvement or if the patient is cured from the disease, you would immediately celebrate it as, success in clinical practice. And of course, the patient will also become happy. So this is the simplistic way of understanding what is clinical success. And I want today to discuss, how a deeper study of the classical Ayurvedic text will completely change our perspective on what clinical success means. In fact, I was very surprised and intrigued and also fascinated to see that in the classical Ayurvedic text, this kind of success is not accepted. I mean, the classical texts categorically dismiss such kind of success as accidental success or yadricha siddhi. So let's begin. So here is a very interesting dialogue. I'm sure we have read this, but still, just for refreshing our minds and going through this again. This is from the Mahati Chatushpada Adhyaya in Charaka Samhita Sutrasthana, where he defines, gives one approach to what is going to determine clinical success. So it's very, very important here that he has put the Chatushpadas into perspective. Chatushpadam Shodashagalam Bheshajamidi Bhishajo Bhashande Yaduktam Purvadhyaye Shodashagunamiti. Sorry. Tat Yukti Yuktam Alam Arogyayedi Bhagavan Punarvasuratreya. So when the Chatushpadas come together with all the 16 qualities, that is when we can be sure that a clinical intervention will result in a successful outcome. So this is what Punarvasu Atreya tells very simply. But then he is confronted by very strong criticism. So I want to say this criticism, which is a perennial criticism, even today, this is what we are facing. When Ayurvedic physicians treat a case and there is a okay, just a moment. Doctor, yeah. Let me see how I can do that. I'm sorry if there's just a technical issue that needs to be looked into. We'll just resume in a moment. Okay, let us continue. So when Atreya explains that this is what determines clinical success, he's, as I was mentioning, he's encountered by skepticism. In fact, we can see that two kinds of skepticism regarding the clinical treatment outcomes can be seen in our classical texts. One is from the outside, which is called external skepticism. And the second skepticism is from within the tradition itself. So two instances are described in our classical text, questioning, the definition of clinical success. One is by Maitreya, who seems to be like an outsider, and then the second is Agnivesha. So we will quickly determine the arguments that these people have put forth regarding, what should be clinical success in Ayurveda, and then we will proceed to our discussion. So this dialogue between Maitreya and Atreya is recorded in the Mahati Chatushpada Adhyaya of Charaka Samhita. And the dialogue between Agnivesha and Atreya, which is an internal skepticism, is discussed in the Uttarasthanam, the last chapter, the 40th chapter of Uttarasthanam of Ashtanga Hridaya. So at the outset, what I want to point out here is that this clearly indicates that Ayurveda gave a scope for questioning and criticism when it comes to discussing, what is success in clinical practice. We all know the famous verse in Vagbhada, idam agama siddhatva pratyaksha phala darshanat mantravat samprayuktavyam nam imamsyam kadachana. So when you say here is a conflict, before we get into the discussion, I want to put things also in perspective there. When we say that Ayurveda Shastra is amimamsyam on the one hand, does it really make sense to even discuss about success in clinical practice? Should it not be just accepted? Idam agama siddhatvad pratyaksha phala darshanat mantravat samprayuktiyam poktavyam. I mean, we have to follow this just like a mantra. So just accept the result as it comes. Is there any scope for even debating on this matter? That is the question. So we will come back to that issue later, but let's start the discussion on the perennial Purva Paksha. So Maitreya questions Atreya and he says, Neti Maitreya kim karanam drisyandehi adura kejid upagaranavantascha paricharaka sampannascha atmavandascha kushalaischa bhishagbhir anushtidaha samuttishtamanaha tatha yuktascha apare mriyamanaha tasmad bheshajam akinchit karam bhavati. So Maitreya is telling that this is very interesting. This is a very statistical, question that Maitreya is posing. He says, Drishyande hyadura kejid upagaranavantaha paricharaka sampannaha atmavantascha kushalaischa bhishagbhir anushtidaha. You just said that this Chadushpada is the basis for success in clinical practice. But I can show you hundreds of instances where all these upakaranas were there. The Chadushpada, Shodashagalam Chadushpadam is available. The best patient, the best physician, the best treatments, the best attendants, all of them come together. And sometimes the patients are getting better, sometimes they are not. So since there is no consistency in the clinical outcome, some patients get better, some patients do not get better. So tasmad bheshajam akinchit karam. So I cannot trust that medicine is really creating an impact on the outcome of a patient. I want to tell you that this is extremely important passage in the classical text. We have perhaps not, looked at it from that angle. here, very clearly, Maitreya is pointing out, this is also the criticism that we are facing from the modern scientific community, even today, is that the outcome in one person cannot be generalized to the whole population. So Maitreya is bringing our attention to the fact that while he says we don't deny that some patients are getting better with your treatment, but when we extrapolate to the larger population, we are finding that there are other patients who get the disease, but get the treatment, but they don't have a positive outcome. This is a big problem. So what Maitreya is talking about here is that when you're discussing about clinical success, you have to bring before you all the cases which succeeded as well as the cases which failed. And unless we look at both sides, we will not be able to make a judgment. I have also noticed, like most of the time, as clinicians, we are very silent about our failures. When we broadcast our successes, so powerfully, but we are extremely silent. We don't want to discuss our failures. So it's very interesting that Maitreya is clearly giving us that discomfort, but by pointing out that Tatha yuktascha apare mriyamanaha. I agree that some of your patients are getting better, but what about the ones who receive your treatment and still do not survive or still do not get better? Unless you give an answer for that, I will not be able to accept that your treatment is of any benefit. So this is the first encounter that as a clinician, we should be ready to face. How can we account for our failures? Accountability is extremely important before we can even talk about the word clinical success. It's very, very easy to become a roaring successful practitioner. Even quacks are very successful. I'm not belittling us. I'm not telling that we are all quacks. But what I'm saying is that we shouldn't be classified into that category. And this is also the approach to the classical Ayurvedic texts. Who is a respectable physician? How does a respectable physician define clinical success? So that's the definition that we are exploring today. So here Maitreya is telling that I cannot see a clear correlation. I cannot see a clear cause and effect relationship between the success that you see in your practice and the treatment that you give. Yatascha pratikurvan siddhyati pratikurvan mriyate. Apratikurvan siddhyati apratikurvan mriyate. Tatas chintyate bheshajam abheshejena avishishtamiti. So this is very interesting. This is a statistical question. This is a research question that Maitreya is asking. Yatascha pratikurvan siddhyati. You treat and they get better. Okay. But pratikurvan mriyate. You treat and they still also die. Okay, just a moment.
Ramji?
Yeah.
Yeah.
I've just admitted all. Yeah.
Sorry.
Yeah. So that's why I came out of the I came out of the full screen, because then I will not be able to see this.
Yeah.
And I don't know how to give up. Yeah.
You just click on your name in the participants. You just click on your name, so you can see you are a host. You just change that.
Okay.
Just unhost.
Okay.
So you are not anymore host. Then it will be easy for us to do.
Yeah. But I am not seeing that option here. When I click,
I think in the
I can see participant list. I have only an option to mute myself, because the host status has to be retaken by the organizer. I mean, I cannot give up. So you will have to just reclaim the host.
Okay. Ramon sir, can you reclaim?
Checking.
Just revert.
He's the host, still showing he as a host.
So can you revert
True.
back?
There is an option that the person who was the host first can reclaim the host.
No, he has to go and click on our name, Ashtanga Ayurveda, and right click on the name and reclaim. go to Ashtanga Vidyapit login, the user.
Okay.
Right click
Yeah.
on that. Right
So,
click on that. Make it a
Yes.
yes.
Done.
Done.
yeah.
Thank you,
Yeah, I
Ramji.
was trying on. Yeah. Okay.
Now you can
So
go to
let's end.
slideshow also. Now you can go to
Okay,
slideshow.
fine.
Okay.
Right.
Thank you.
Okay.
Now you can do slideshow also. Yeah, fine.
Okay, fine.
Perfect. Okay.
Okay. So yeah. So here it is. Yatascha pratikurvan siddhyati pratikurvan mariyate. You give a treatment, some people get better. You give treatment, some people don't get better or even die. Apratikurvan siddhyati. You don't even give any treatment and they get better. Apratikurvan mariyate. You don't give any treatment and they also die. So this is very beautiful. I mean, they had really understood this problem of statistical correlation, cause and effect relationship. And maybe there was no Maitreya. This Maitreya was a creation of Atreya himself, creation of a Purva Paksha to make us thinking. And I think this radical thinking has to be brought into the community of Ayurvedic practitioners. If we are to establish Ayurveda, as a credible, ours is a yukti-based system. I don't want to use the word evidence, but at least we can also say in a modern sense, if we want to present ourselves as evidence-based system, I think we need to go back to our roots. That's what I want to talk here today. Just by doing meaningful, unmeaningless randomized control trials, all modern methods of research, we are not going to move forward, because all our clinical decision making, what makes Ayurveda, what brings out the strength and power of Ayurveda, is what happens inside the clinic of an Ayurvedic physician. In modern medicine, guidelines are made by researchers and physicians are just implementing. But for an Ayurvedic clinician, a decision can be taken or a medicine can be decided only when there is a clinical encounter with the patient. So all the creativity is happening in the physician's clinic. And so all the evidence has to be generated from the clinic. And this is why I think we have given up this task of producing evidence to researchers and who are absolutely unaware of what's going on in the clinic. And this is why I think if we go on in this way, we will never make Ayurveda credible or evidence-based. So I want to here discuss today how we can redefine clinical practice and clinical success from an Ayurvedic point of view, and how as clinicians, we bring about a new discipline, a new culture of generating and answering Maitreya every time we treat a patient. We have to keep this in our mind, that whenever a patient we are treating in our clinic and you are getting a result, there is a Maitreya standing outside questioning you, and an Agnivesha inside your own room questioning you. And this Maitreya and Agnivesha are actually to be placed in our own minds. That is what Atreya and Vagbhada wanted to do. He was creating a Maitreya to be placed in our mind. Vagbhada created that Agnivesha to be kept inside and outside, so that we are always alert and aware and critical and thinking about the outcomes of our treatment. So this is Agnivesha. So this was Maitreya's question, skepticism. If Maitreya was a skeptic who looked at it from outside, it did not matter to him whether Ayurveda was effective or not. He just told his opinion. See, I'm not seeing a correlation, so I cannot believe that your stuff works. But Agnivesha is a dilemma, because he's going to be a physician. And if he has a doubt whether his treatment is going to work, it's going to be a real problem. So we have a beautiful, scene in the last chapter of Ashtanga Hridayam, Uttarasthanam, where Agnivesha is approaching Atreya. Itti Atreyad Agamaya Artha Suktam. Tat Suktanam Pesalanam Atriptaha Bhedadinam Sammado Bhakti Namraha Paprachedanim Samshayano Agnivesha. So even after learning all this from one of the best teachers of Ayurveda, Atreya, and the best and the most brilliant disciple, Agnivesha, has studied from one of the most accomplished teachers, masters of Ayurveda. So it is very surprising. That is what the text is also telling, that if even after learning from such a great teacher, and the best student that Ayurveda has ever seen, there was still a room for a doubt. So then what is the question when it comes to people like us? We also need to critically think. That is what I think this passage is telling us. So we are all potentially going to be Agniveshas even at the end of our course, even after the end of our studies. It's very likely that we will have this question, and this question must be addressed. So Agnivesha is again putting these same questions, the similar questions raised by Maitreya, but in a different way it is presented in Ashtanga Hridayam. Drishyande Bhagavan Kejid Atmavandopi Rogina Dravyopasthatru Sampanna Vruddha Vaidyamadhanugaha Kshiyamana Amaya Pranaha Viparitas Tathavare Hitahita Vibhagasya Phalamascha Asmad Anishchitam. So the same thing he says. See, there are so many people who are following all these treatments and they are getting the best medical care, still they are dying. And there are others who are escaping, they are surviving without all this. So I feel that the role of treatment is anishchitam. So here again, I want to tell you that there is no denial that Ayurvedic treatment works. Both Agnivesha understands that people are getting better. So even when people are getting better with our treatment, this skepticism is there. And my question is, are we skeptical enough that way? Are we all not just satisfied with just the successes that we get? Are failures really prompting us to think, deeper? Why did we fail? Why did it fail in some patients? Why did it, succeed in others? If we are asking, I think both in Charaka Samhita, Atreya and Vagbhada wants us to ask this question, even when we have success in our clinical practice. So here is Agnivesha's question, Kim Shasti Shastram Asmin iti kalpayado Agnivesha Mukhyasya Shishya Ganasya Punarvasura Achakhyau Kartsyadas Tattvam. So he is now giving the answer, Atreya is now giving the answer. Why is it happening like this? Why are some people getting better and why are some people not getting better? And is there really a role of treatment in bringing up the clinical success? And here is the reply of Maitreya, Mithya Chintayada Ityatreya. Mithyam Chintayada. Your thinking, thought process is wrong. Kim Karanam? Ye hyadura shodachaguna samududena anena bheshajena upavadyamanam riyanta ityuktam tad anupapannam. Nahi bheshaja sadhyanam vyadhinam bheshajam akaranam bhavati. Ye punaradura kevalad bheshajadrade samuttisthande na tesham sambhurna bheshajopapadanaya samuthana vishesho nasti. Yatahi patitam purusham samartham utthanaaya utthapayan purusho balamasya opadadhyad sakshiprataram apariklishta eva uttishted. It's a long passage. I'm just reading it out because of the beauty of the original text. Tadvat Sampurna Bheshaja Opalambad Adura Ye Chadura Kevalad Bheshajadapi Viryande Nacha Sarva Evate Bheshaja Upapanna Samuttishtheren Nahi Sarve Vyadhayo Bhavanti Upaya Sadhya Nachopaya Sadhyanam Vyadhinam Anupayena Siddhirasti Nata Asadhyanam Vyadhinam Bheshaja Samudayo Yamasti. So what he's telling simply is that all diseases are not curable. So sadhya sadhyatum is one thing, one of the primary things that we must look at. So in a disease which is bheshaja sadhyam will never fail to respond to treatment, whereas a disease which is bheshaja asadhya will not respond to whatever treatments you give. So if you do not, so this became a very fundamental principle in Ayurveda. Sadhya sadhya vibhagatnyo. This is very important. Artha vidya yashohanim anyata dhruva apnuyad. If you don't, do this assessment of the disease, is it sadhya or asadhya, then, you will have to face negative consequences. So the point that I'm going to make here is that this was the first reply from Atreya, which also has been beautifully summarized in Ashtanga Hridayam. Na chikitsa cha tulya bhavitum arhati. Vinapi kriyeya swasthyam gachadam shodachamseya atanga pangam agnanam hastalambo bhishajjidam. Jivitam riyamanam sarvesham api naushadhat Na hyupayam apechande sarve roga na chanyatha upaya sadhya siddhyanti na hetur hetumanyata yaduktam sarva sampatti युक्तयापि चिकित्सया मृत्युर्भवति तन्नैवं नोपायेस्ति अनुपायता अपि चोपायुक्तस्य धीमतो जातुचित्क्रिया न सिद्धेत् दैव वैगुण्यान् न त्वयं षोडशात्मिका. So of course again this is a long Sanskrit recitation, but I will just summarize what Atreya replies is in similar vein here, where he also emphasizes now saying that even in diseases where which are self-limiting, which would get cured by themselves, treatment is a support. Atanga pangam agnanam hastalambo bhishakchitam, which means that even a patient who might have got up by himself, by giving treatment, you are helping him to get better in a much quicker way. So the bottom line here is that upaya sadhya siddhanti. So if a disease which is responsive to treatment will respond only if treatment is given. Treatment which do not need, diseases which do not need treatment will get better even without intervention. And this is how this, this paradox that Maitreya and Agnivesh observed has been explained by Atreya. So, with this background, Charaka tells us, this is the key point that I want to come to, is that vina tarkena ya siddhi yadricha siddhirevasa. So without a supporting rationale, success in clinical practice is accidental. It will be just dismissed as just by chance. So success in clinical practice has been well defined, and this is where I want to introduce this concept today. We lost some time, of course, so I will try to go into other details also quickly. So here is this concept which is so beautifully brought out by Chakrapani. Samyak prayogam sarvesham siddhirakhyadi karmanam siddhirakhyadi sarveshcha gunair yuktam bishaktamam. So this is how siddhi happens. Success in clinical practice is defined in the first chapter of Charaka Samhita itself. And this is where Chakrapani brings a very interesting terminology, which you don't find in the classical text, but it is so relevant, which enables us to even, confront the modern criticism against Ayurveda not being evidence-based. Siddhi rakhya didi ukta pratiniyamiki siddhi na yadrichiki. This is a term that has been coined purely by Chakrapani, and he mentions it only in one or two places. So if we don't read the commentaries very carefully, we will completely miss it. But this prati niyamiki means prati niyamam, niyamam prati siddhi, which means repeatability. Every time you do that intervention in the right context, you will get the same result. And only when result comes in that way, we can call it as real success in clinical practice. So Chakrapani again beautifully brings out a big debate and discussion here. Tadeva yuktam bhaishajyam yada arogyaya kalpade sachaiva bhishajam sreshto rogebhyo ya pramochayet. So this is again talking about clinical success, in practice in Ayurveda, Charaka's statement in the Sutrasthana first chapter. And then here again, Chakrapani gives a very nice explanation, brings about this concept again. Rogebhyo ya pramoche dityanena cha jnanapurvam bheshaja prayogena. The physician is not really, he's doing predictive medicine, jnanapurvakam. He knows what medicine will produce what result in what time. So there is absolute predictability. That is what is called as pratiniyamiki siddhi. How much time do I think the medicine will take to work? And in Ayurveda, we have already very clear guidelines on this. Prayakarutya horatrad karma anyada vibheshajam. In 24 hours is the maximum time for a single dose of medicine to show some action in the body. Saptahena gunalabhe kriyam anyam prayojet. So we have very well defined measures to predict treatment, the result of treatment. So that predicting the outcome of a treatment, if you can predict the outcome and then show that it is happening, then it is clinical success. This is what Chakrapani is pointing out here. Tena yadrichika siddhya kuvaidya vyavaharo na vachya. So those who are not able to demonstrate pratiniyamiki siddhi, which means that repeatability, those who are able to explain why a negative result happened in the patients that they treated, those who are able to predict before the outcome comes, this is the outcome that I'm expecting in this patient in this period of time. These are the symptoms that will manifest. If you are not able to do that, Chakrapani dismisses such vaidyas as kuvaidyas. Yadrichika siddhya kuvaidya vyavaharo na vachya. Yadrichika siddhau hi vaidyo na roga pramokshe karanam. So this is absolutely important, because today this is what we are being completely criticized. Whenever Ayurvedic physician treats a disease, the modern scientific community says they don't know what they are doing. That must be due to spontaneous remission or placebo effect. And we need to clearly, first of all, understand ourselves that this kind of, it's not that our acharyas were not aware of such a possibility. This has been so blatantly described in our classical texts. Yadrichika siddhahu hi vaidyo na kuvaidya. They have been mocked at as kuvaidyas. Physicians who are not sensitive to making this differentiation, who simply talk about clinical success without looking at the other parameters that Maitreya and Agnivesha pointed out, or what Chakrapani pointed out. So kintu gunachara nyayena daivagado bheshajasa samyag yoga. And he uses a very nice nyaya here to dismiss the success stories of kuvaidyas. He says that this is like gunakshara nyaya. Guna is a worm. The worm may take different shapes. Sometimes the worm may take the shape of a letter, but the worm doesn't know that it is taken the shape of a letter. In such a way, kuvaidyas get success in clinical practice without really knowing what is happening. So if you are not able to, that is why Charaka says, Vina tarkena ya siddhi, yadricha siddhi revasa. So now already through this discussion, we get a lot of parameters and criteria on the basis of which we can define what is success in clinical practice. So first and foremost, as Charaka has very clearly explained, you should be able to do a tarka of your treatment, the outcome. How can you explain that the patient got better? What is the tarka behind it? If there is no tarka, it is yadricha siddhi. The second thing is pratiniyamikatva. Can you repeat that? Can you tell it is like a niyama prati niyamam prati? It is following a rule or a law. Every time you repeat it, you must get the same result. That is the second criteria. Third criteria is, will you be able to predict what will be the outcome before it happens? Then only it is pratiniyamiki siddhi. Otherwise, according to the Ayurvedic criteria, it is yadricha siddhi, and we will not be able to accept it as, success in clinical practice. So now I'm defining our topic here today. So success in clinical practice is pratiniyamiki siddhi and not yadricha siddhi. So it is not enough just to show siddhi. We must show that this siddhi is not yadricha. This is pratiniyamiki. So by bringing tarka to support the siddhi, you can make your siddhi pratiniyamiki. So only success in clinical practice, which is backed up by rationale, can be considered as success in clinical practice. So this means that as physicians, I think is very, very important is that we must start creating open discussions about our clinical successes. We must dissect it. We must question it. Any practitioner who has had a success in his clinical practice should be willing to reveal the outcomes, what they did. And this should be subjected to Shastra Sahita Tarka. And the rationale behind that should be made explicit. And then these kind of successes should be chronicled as, instances of pratiniyamiki siddhi. And this is how in Ayurveda evidence was generated, not by conducting randomized clinical trials or, laboratory experiments. We were clinicians. And if we can start this process, I'm not saying we don't need lab experiments or RCTs. They can be add-ons. They are only add-ons. These modern methods of research is only helping us to communicate to allopathic physicians. They are not the primary methods of research. So I want to make with my experience in research, I'm basically identifying myself as a researcher. I've tried to do randomized control trials when I was in AVP. We did also with NIH, one of the most prestigious clinical trials. But all these things has led me to the conclusion. I'm also engaged with laboratory work here. We have a very good laboratory at Amrita School of Ayurveda with a lot of sophisticated equipments. But all this experience has led me to understand that primarily to make Ayurveda evidence-based, Yukti Vyapashraya Chikitsa, Pratinamiki Siddhi, we have to follow these guidelines given by Acharyas. If we follow these guidelines and bring out the Pratinamiki Siddhi evidence, then adding it with modern methods of research will make it even more contemporary and more communicable. But if we don't do this exercise just by doing RCTs, or we are not going to make any difference. So, and now let us, in the remaining time, maybe we have another 10-15 minutes. Am I right, Dr. Nambi?
Yeah. You can take another 15 minutes.
Okay. So there is a very beautiful description again about how we can bring success in clinical practice. Nahyalam jnanavan bhishak mumurshum maturam utthapayetum parikshakarino hi kushala bhavanti. So he tells, if you want success in clinical practice, don't be fooled by the fact that your patients got better. I want to tell a story. Many of our clinical practice like that. There was a person or a lady, I don't remember it was man or woman, whoever it is, was not, they found that the car was not starting in the morning. So, we all do this sometimes. If something doesn't work, we just bang it or hit it, and sometimes it works. And we think that it is because of some loose connection. These kind of loose connections are there in our minds also. So sometimes if we bang our heads, also things fall in place. So we do that with machines and equipments around us also. So this lady would go and bang on the bonnet of the car. And when she bangs, the car would start. So this went on for a long time. And she thought, wow, how clever I am. I don't have to go to a mechanic. It's working every time. But one day she kept banging and the car wouldn't start. And she had no clue what was wrong. So she was successful. Umpteen number of times she was successful in starting the car without even a clue as to what was happening. She would just bang on the bonnet and it worked. But this time when it didn't work at all, the lady went to a mechanic. And as she was walking, the mechanic just opened the bonnet, did something and closed it. The mechanic didn't have to bang the bonnet, just opened it and did some small thing. And now she told, it's fixed, you can start your car. And lo and behold, the car, cranked. The engine cranked and the car started. So the lady was very surprised. I mean, what did you do? It was so simple. So the mechanic said, it's nothing, the battery terminals, there was a lot of, rust accumulated. So it had become quite hard. So I had to just scrape it away. And now the lady realized that every time she was banging the bonnet, the rust would be, just thrown off because it was very little. But over a period of time, the rust had become so hard that just banging on the bonnet did not work. So this kind of success is what Chakrapani talks about as Daiva Vashad. You do something without knowing, but it still does the job. But you need, when you do it consciously, only then Pratinamikatam will be. Because if I know what is the cause, what is the reason, why it is working, then every time the problem comes, I will be able to find a solution. And this is why Charaka clearly says, Parikshakarino hi kushala bhavanti. Yadhahi yogatnyo abhyasa nitya ishwaso dhanuradaya ishum asyan nati viprakrishte mahati kaye naparadhavan bhavadi sampadayadi cheshtagaryam tadha bhishak swaguna sampanna upakaranavan Vikshya karma arabhamana sadhya rogam anaparatha sampadayatyeva atura arogyena tasmanna bheshajam abheshajena avasishtam bhavati. So here it's so beautifully the physician has been considered to an archer who takes aim with his bow and arrow and then finds the object and is able to make an assessment whether he can really hit it, and then by practice is able to do this. So this is the methodology of such aimings, be treating with awareness, understanding mechanism, understanding predictability. I would clearly say from the strict, parameters and standards that Ayurvedic texts have kept, if we are not able to predict the outcome of our treatment, then it means that, we are not successful in clinical practice. Even if you get, it would be dismissed like the lady, are we just yadricha siddhi vaidyas who are like the lady banging the bonnet of the car? Or are we like the mechanic who opens the bonnet and actually solves the problem? This is what really makes the difference between clinical success and not. And this is the difference that will make Ayurveda evidence-based and more visible. So as clinicians, we don't need to do clinical trials. I'll show some simple methods that we can follow to generate this kind of evidence. Here I want to show a difference. Even though Atreya has used this imagery of a bow and arrow and the archer, there is a difference. The allopathic archer and Ayurvedic archer are different. Ayurveda needs a different kind of training. In allopathy, it is like a fixed target, one molecule, one mechanism, and the target is straight in front of you. You just need to understand, take aim and shoot. It's very simple. But in Ayurveda, we are like Arjunas. Here is Arjuna. He wanted to marry Draupadi, and then they made him do this kind of an activity. So today's world, to get Ayurveda recognized, recognition is like the Draupadi of the modern day. Recognition in all the 5-6 continents of the world. If we want that, we are now asked to produce evidence. And our task is like Arjuna's, because Arjuna was asked to shoot the eye of a fish that was revolving and rotating, on a wheel that was above him, that was at a particular height. And he was not allowed to look directly at the fish. He had to look at the reflection of the fish in a tub. And looking at that reflection, he had to shoot the eye of the fish. Now, this is the skill that an Ayurvedic physician needs in clinical practice to become a Pratinamiki Siddhi-based physician. See, in Ayurveda, avastha vidanameva chikitsa. I found this imagery so beautiful and so apt to explain how an Ayurvedic physician thinks. See, we are looking at avasthas, which are continuously changing. And allopathic treatment is not that way very avastha-based. It is more mechanism-based, it's more stable. Take an antibiotic, 5 days course. After that, only you have to see if it's in Ayurveda, muhur aveksha, purusham vikshya. And then according to avasthascha prithagvitha. So the avasthas are changing, and we are not able to see the avasthas directly. We see it reflected through the dosha lingas. We are not able to see it directly. So we see a reflection of what is happening inside the body through the dosha lingas and other roga lakshanas, which is like looking at the image, the reflection in the water tub. And by seeing that reflection, we have to hit the target. So in my understanding, to become a really accomplished clinician, Ayurveda is much more difficult than in modern medicine, where the archery is much more simpler. So what then is the tarka that defines success in clinical practice? Only so when you are doing tarka in your clinical practice, you can claim to be successful. One is sadhya sadhyada, ayu pariksha, daiva vaigunya. Like if some cases, daiva hriday, this is a very important concept, this concept of karma vipaka. Some cases are there where they are not very common, but where even the established treatment may not work. Purvaparadhaja kaschit drishtaparadhaja tatsangarat bhavatyanyo vyadhirevam tradhamada. So that concept is also very important in Ayurveda to explain why some treatments will not work. So the next important thing that we have to discuss is the natural course of the disease. We have to ask ourselves, whenever we had a success in our clinical practice, what would have happened if no treatment was administered? Would the disease have cured by itself? Or would it have taken longer to resolve? Or would it have worsened and become severe? This is very, very important. If the answer is number 1, then it means your treatment had no value. If answer was 2 or 3, then it means that your treatment made some contribution. And it's very important that we claim, the right thing. In today's, everybody is claiming that Ayurvedic treatment is given and COVID patients are getting better. So 99% of COVID-19 patients will get better even if you don't do anything. So if we don't have a comparison, if we don't specify the inclusion-exclusion criteria, getting a success by treating a patient is absolutely no basis for telling that Ayurveda works. And that's what Charaka also is telling us. We'll come to that. So was something else responsible for the improvement? This is another question to be asked. Could be another treatment, concomitant allopathic medicine. A change in climate, because we say Nidana dosha dusha visheshebhyo vikara vikhada bhava bhava pradivishesha bhavat. In Panchavidha Jwaram, it is said malakala balabala. So when the balabalattu of these doshas and the kala and all that change, then suddenly a disease may just disappear on its own. And there we cannot make a claim. So first thing is, what was the natural course of the disease? Second thing which we have to answer is, was something else responsible? Diet, physical activity, even a placebo effect. In Ayurveda, we have, Charaka has told, manasaha arthanukulyadhi tushtirurja balodaya. When mind is favorably disposed, tushtirurja balodaya. Sukhobabhoga rajasyad vyadheschado balakshaya. So without giving any treatment itself, even according to Ayurveda, if you do manasa arthanukulyam, then the disease will reduce. So what if something else was responsible should also be studied. And here I want to tell you the very simple methods, two methods that we could use to demonstrate success in our clinical practice. This has been proposed by some Swiss researchers. And one of these methods is called as RTO. Now I want to propose RTO instead of RC. So RTO is very simple, retrospective treatment outcome study. If you have, now one big question is, different treatments are given to different patients. Most of us Ayurvedic physicians don't give the same treatment. Each one of us gives our own treatment, and we don't want other people to know what we gave, but success may be there. So here we just need to look at different outcomes and compare. So a modern treatment, when it was given to a patient, what happened? When Ayurvedic treatment was given, what happened? When some other Ayurvedic physician gave a treatment, what happened? And then we have to very carefully look at the patient population. If they are comparable in a comparable patient population, we can easily compare retrospective treatment outcomes. And this is a very simple way to generate evidence out of clinical practice. Another one is prognosis based. So I want to tell, these are both designs which are very similar to what Charaka Samhita is talking about when he says Tarka. One is prognosis based, means you must have a prediction of what would have happened without treatment, and then you see what happened with treatment. So there is no actual control. The control is the natural course of the disease. Your understanding of the natural course of the disease is the control. And so you put a roadmap. This is how the disease will go if I don't give any treatment. Now I have given my treatment. Without treatment on 5th day, 6th day, this is what would have happened or expected to happen. But with my treatment, this changed. So this is called also as prognosis and outcome, method of generating evidence. So I want to present these two methods as very simple ways in which we can generate outcomes about clinical practice. Now I want to also point out a very, very important thing. We are hearing very nice sounds. Maybe some mics could be muted. So did other interventions give the same results? So if different physicians are administering different treatments and the same result is obtained, this is what makes Ayurvedic medicine look so disorganized. When somebody from outside is looking, 5 or 10 physicians have given the same disease they are treating. But each one is giving different treatments, and whatever you give, the patient is getting better. Now, this is when a critical person from outside will say, now this is a new issue. In Maitreya and Agnivesha, we are only talking about one treatment working in some people, not working in others. Today, the thing is, there is no standard. Everybody is treating in every whatever way they feel. In the COVID situation, we had, I think, almost 8 lakh prescriptions. Every Ayurvedic physician came up with his or her own protocol. So, and everything is working. Everybody is claiming that their protocol is working. So this when such a situation comes, people question. It could be a placebo effect. It could be whether the disease is self-limiting, because Charaka also very clearly says, for every disease, for a bheshajam, only a treatment based on a particular principle will work. Yad anadurena bheshajena aturam chikitsama, kshamam akshamena, krisham cha durbalam apyayama, sthulam medasvina apatarpayama, shitena ushnabhibhudam upacharama, शीदाभिभूतम उष्णेन न्यूनान् धातून् पूरयाम व्यतिरिक्तान् ह्रासयाम व्याधीन् मूलविपर्येण उपचरन्त सम्यक् प्रकृतौ स्थापयाम तेषां नष्टा कुर्वदाम अयं भेषज समुदाय कान्ततमो भवति. So this is what Charaka very clearly says. For a particular treatment, there is a particular principle. Just because we do anything, it will not work, and we have to identify the kantatama or the siddhatama, which is the one which is working best. So Chakrapani, I'm not going into Chakrapani, gives a lot of explanations on how to differentiate between Siddha treatment, Siddhatara treatment, and Siddhatama treatment. So in Ayurveda, there was a system where we would have identified the Siddhatama treatment. Charaka says, Tesham Siddhataman Yogan. So we have to be also able today to explain to the world why. Maybe medicines are different, the principle is same. So if 10 Ayurvedic physicians are giving 10 different treatments, but we are getting the same result, we have to give an explanation or tarka as to why that is happening. Otherwise, it will also be dismissed. So just a few more points and we will conclude. In Ayurveda, there is a very clear distinction between correlation and causality. Sahacharya is association. Vyapti is correlation. So it's a very clear concept in modern research that correlation is not causation. In Ayurveda, only paramarsha, vyapti visishta paksha dharmada jnanam, paramarsham is the basis for causation. So what is paramarsham? I want to very simply explain this. We have this concept of paksha, sapaksha, and vipaksha. This is used in clinical trials today. We have the trial drug, we have the positive control, and we have the negative control. If you look at the concept of vyapti visishta paksha dharmata, it is the same idea for anumana. So when we are doing a cause-effect relationship, anumana is a way to establish cause-effect relationship. So sandigdha sadhyavan paksha, where we do not know whether there is a cause-effect relationship, that is the trial medicine or your treatment. Nishchita sadhya bhavavan vipaksha. Vipaksha is the negative control, where you know that something will not work at all. And nishchita sadhyavan sapakshaha, which means it's a positive control. So with no treatment, there should be no response. With treatment, there should be a response. And one treatment should be compared with another established treatment. So this is the method of establishing paramarsha and causation. I'm not going into the full details. I just want to tell that this method of establishing success in clinical practice can be done very rigorous, even using the principles of an RCT clinical trial without really doing an RCT trial. And we should use these terminologies. One more concept, and outcome measures, that is very important. On what basis do we say a patient improved? So the right outcome measure should be used. Here also in our classical thinking, we have very clear ideas. Sensitivity, specificity, challenge, de-challenge. We should use hetus or outcome measures which have three characteristics. One is avinabhava sambandha, means specific sensitivity. Sensitivity means every time you do the test, there should be no false positives or false negatives. So it's very fascinating that our Anumana Pramana has all these concepts ingrained in it, and that we can all use this in clinical practice. So sensitivity is not having false negative or positives. And then specificity, that is, it is very specific. ESR is a test which is Vebhichari. It's not very specific, it's non-specific. So if we don't use outcome measures that are sensitive and specific, and then we must also look at the challenge, de-challenge, that is Ayuta Siddhatum. You give a treatment, the patient improves. If you withdraw the treatment, there is deterioration. So then only you can establish there is a cause and effect relationship. So what I wanted to tell is this: Vina tarkena ya siddhi yadricha siddhi revasa. That concept, I only wanted to give a glimpse that what is that tarka that as Ayurvedic clinicians we have to do. I want to say that it's not modern research that can be only an add-on. Modern research is only an add-on. We should do our own tarka. Our tarka, which our acharyas have said, is the research that we have to do. And this has to be done by the clinician. And only when our clinicians are able to bring this into actual practice, we can say that we are successful in that. As Chakrapani said, we are not Kuvaidyas. The Vaidyaha Roga Pramokshekaran. And we are not like the worms. No, the Gunakshara Nyaya cannot be applied to this. So we need some Shastra behind diagnostic decision making. I have proposed the Ama Dosha Sthana system. Therapeutic decision making, our prescription is very complex. It's not just one single medicine. So we have to explain how from the diagnosis this treatment came. So here is an AMA classification chart. I'm not going into detail. I'm just telling that, when you do a Vamana, Sadhyo Vamana. A Sadhyo Vamana can be done only by assessment of AMA. The dosha has to be in Chalavastha. If the dosha is not in Chalavastha, you should not do Sadhyo Vamana. So you can give the rationale that way. Similarly, dosha Vikalpa. Vada Pitta is different from Pitta Vada. So the same medicine may not work. So this Sukshma Dosha Vikalpa is another important aspect that we have to bring in the Tarka to explain why our treatment work. And then of course the Sthana, in which Sthana the medicine. So there is only a small difference between Amardotaram Kashayam and Vyagradi Kashayam. But one ingredient changes the whole focus, and the whole locus and Sthana in which the medicine works is completely changed. So if we follow this logic, the rationale behind Ayurvedic treatment in our Ayurved's own terms, then I'm sure that we will be able to bring in a new revolution in the field of making Ayurvedic treatment credible. And I think this is the way forward, not doing more and more of modern research. If Ayurvedic clinicians come together to establish Pratinayamiki Siddhi, we would have laid the foundation for Yukti Vyapashara Ayurveda, or in Ayurveda's terms, evidence-based medicine. And then if we can do on top of it some preclinical studies, some RCTs or whatever it is, that is only for communicating to the modern medical community. So this is my appeal. And I hope that, these thoughts which I shared with you today make some sense and meaning. And if it was useful, I feel very obliged. And I once again thank Ashtangam Ayurveda Vidyapeetham, Dr. Nambi, Dr. Binoy from Pacto, for having organized this meeting and for having invited me to share my views. Thank you very
much. Ramji, you may be knowing that there's a community of teachers. So definitely there will be a lot of questions regarding the ideas. It was a really wonderful speech, and it was very thought-provoking for all of us, how we should think, how we should analyze the Samhita. So I have a question, Ramji. You mentioned about the repeatability, reproducibility, or predictability, which is often a part of conventional science too. Did you find anything extra Ayurveda has beyond the frame of science that could be also added values beyond the frame of that?
Yes, because it's a very important question, because in modern medicine, the repeatability is based on the idea of one size fits all. Like if it works in one patient, it should work in everybody. In Ayurveda, the idea of repeatability is avastha vishishta. Samyak prayogam sarvesham siddhirakyadi karmanam, which means that precision, the repeatability is dependent on the precision. So in Ayurveda, we say that repeatability is not based on the idea that if it works in patient A, it should work in patient B. Because in Vata Rakta also, two Vata Rakta patients may not respond to the same treatment. And here predictability means predicting what will happen in that particular patient, not by saying that. That is why clinical case studies are more important for us. We cannot study on a large population. Retrospectively, we have to collect data and then generalize. This is what I have understood. So predictability in my thing is, I am giving this medicine for this patient and I am expecting this result. And I am going to predict that this medicine will not work in the second patient. Here I am going to give another medicine and I am going to predict that that will work in this patient because he is different. So this predictive. This is a very important question. I'm glad that you asked that. Otherwise, people might mistake that we are also thinking about the same idea of predictability, which is really the basis of modern evidence-based medicine also. So I hope I answered that question.
Yeah. Thank you, Ramji. Anybody can ask, please.
So,
Yes.
Yeah, Deepti.
Namaste, sir. Myself, Dr. Deepti from Shantigiri Ayurveda Medical College. So the class delivered by you was really a great inspiration. But I had two queries related to that. The first one is, how can we identify the Daiva Vaigunya in our day-to-day practice? And once we identify, what should we do? Means what should be the next step? And the second query is related to the concept of Upashaya Anubashaya in our Shastra. We often try that thing in our clinical practices. So how can we justify that concept in the idea that you had delivered today?
Yeah. Very good. Very, very important question. I mentioned this Daiva Vaigunya because, in my experience, these are unexplained things even in modern medicine. Many times modern medicine doctors do not know why some patients don't respond. So you could deal with it in different ways. Now, when you come to Daiva Vaigunya, there is also this element of belief. One is that if you have belief in astrology, if you want to look at it in that direction, that's one path you can take. That I would say this is a very personal decision. Every Ayurvedic physician, somebody who's too rational, may not want to go in that way. So that is one way in which you can explore that to identify that and do this. The other approach is that we have to accept that situation as a disease or a patient which is non-responsive to our treatment. In modern medicine also, such classification is made. They are identified as non-responsive. And then you do further study and research on that. So you don't need to explain astrology then. It depends on how rational you are. Some people, I understand many Ayurvedic physicians will not accept astrology because Ayurveda may become scientific for them, but astrology is not scientific. So astrology is actually I also don't want to go into that. I want to take a neutral position. I want to say you have two choices. Either you follow the path of Daivatnyatvam. At some one period of time, Ayurveda physicians were also Daivatnyas. And astrology is also a very subtle science, knowledge system. So it's your personal experience and thing that makes you decide whether you want to accept it or not. That's the answer to the first question. But as I told you, these non-responsive cases are there even in modern treatment. So they call it as non-responsive patients, and they don't have an explanation why they are not responding. The second question is also very, very important. So there you have brought this idea of Upashaya Anupashaya is done. It is our Ayurvedic method of clinical trial, where you do not know, where you do not have a well-established treatment. It could be in the context of a new disease, or it could be in a patient also where who is non-responsive and where you have to try. But here I want to point out, most of us have actually thought of this as hit and trial. That is not at all Upashaya Anupashaya. Upashaya Anupashaya should also be based on Tarka. Without a sound Tarka, you cannot do Upashaya Anupashaya. It's like you have narrowed down to one or two possibilities. After that only you can do Upashaya Anupashaya. Upashaya Anupashaya is not, I have 10 medicines, I'm going to try one after the other. That is not Upashaya Anupashaya. So, Gudhalingam Vyadhim Upashaya Anupashaya. That Gudhalingatvam is either that it is a new disease like COVID-19, because I found some of my colleagues, they have been treating and new ideas about the dosha vigalpa. Sometimes you are able to confirm the dosha vigalpa only when you give the medicine. So generally we have considered it as a vadagava pradhana sannivada jala, but pittanubandha is there. So many people who have taken this tulasi, pepper and all that, they have complained of pitta vigaras. COVID-19 patients have complained of pitta vigaras. So this shows that there is a pittanubandhatva. So in that way, so we have to do Upashaya Anupashaya in a very careful, and in modern science that would be like you have a hypothesis, you are doing a clinical trial on a large number of patients, but in an Ayurvedic context we are doing that kind of an experiment actually in a clinical context. I think this is the difference. Did it answer your question?
Yes, sir. Thank you, sir.
Okay.
Hello. Hello.
Hello.
Am I audible, sir?
Yes, you are audible.
Yes, sir. Namaskaram, sir. I am Dr. Ramya, Ashtanga Ayurveda Vidyapeetham Department of Panchkarma. Thank you very much for the very wonderful presentation and very thought-provoking presentation. My question to you has got two parts, sir. whatever you said, we definitely agree in the sense, how could where we successful in the case of repeatability when we are treating a particular case. But as a practicing physician, what I always have felt is there are multiple factors that are responsible for getting the outcome. In the sense, even if we decide about dosha, dushya, the srotas, etc., koshta of the patient, the patient response to it, patient's following of patya, all these things are responsible for the outcome as such. Now, once we try to analyze and try to observe and have this realization of what exactly, or we will be able to form the predictability, once you start practicing at 30 or 31 plus, probably by 45 or 50, you will be you will be getting that clarity.
Yes.
Probably we will not be able to work out. And this happens only once we practice. We don't get it from anyone many times. As my experience till date is concerned, sir. So will that be possible that we make out something and we make up a protocol or possibilities so that everyone can repeat, everyone can have a similar repeatability as far as the treatment and disease is concerned? That was my first part, sir. And my second part, adding on to this is, sir, many a times in a recent discussion, we were discussing about the response of a particular yoga to a Vyadhi Avastha. So there were some discussions happening with very senior physicians who were communicating that once you reach a particular point that physician and the patient is the important thing, there is no relevance of even the drug or the yogam that you are talking about. When the physician reaches that level of consciousness, if you just give a dip of water, വെള്ളം കൊടുത്താൽ അടക്കം രോഗിയുടെ അസുഖം ഭേദമാവും. വൈദ്യം എന്ന് പറയുന്നത് ആ ഒരു തലമല്ല, അതിനപ്പുറത്തേക്ക് ഒരു തലവുമുണ്ട് എന്നുള്ള ഒരു ചർച്ചയും ഉണ്ടായി. Because there were some physicians who were treating with 1 or 2 yogas for all diseases. So ഈ രണ്ട് ആസ്പെക്റ്റിനെയും നമുക്ക് സാറ് പറഞ്ഞിട്ടുള്ള ഒരു ബാക്ക്ഗ്രൗണ്ടിൽ എങ്ങനെ കാണാൻ പറ്റും?
Very good question. Very thoughtful. So the first thing that you said, I'm hearing myself. Maybe somebody's mic is on. Okay, now it's fine. So it's very correct. What you said is true. That this kind of now actually you have given the whole roadmap of how an Ayurvedic physician can evolve, and this is exactly what I was also intending. That this thought process, it's true that you need a lot of experience before you will be able to develop this kind of a skill where you're able to predict what will happen. You also pointed out that there will be confounding factors which will oppose, and your predictions may get disturbed, because if you tell the patient to take a diet and he doesn't follow it, or some untoward event happens in the patient's day-to-day life, and then your prediction will change. This is true. This happens. I am talking from experience of having been with some traditional physicians who are thinking in this predictable way. So, they are so clear that they are able to identify. I remember once I was with a traditional physician and the medicine was given and the patient comes back and say, I did not get improvement. And the physician is so confident. He said, if you have taken my medicine, by this time you should have got this result. So the patient at first, tells, no, I have taken the medicine properly. Then he asked, what diet did you follow? So after a lot of questioning, when seeing the doctor was so confident that the medicine would work, the patient finally confessed that he had taken non-vegetarian diet in between. And this has aggravated the condition. So predictability here means also that you are able to identify what could have been the confounding factors that modified your prediction. So this is the power. If you follow in this path, as you said, after 5 years, 10 years, 15 years, 20 years in your practice, you will definitely develop this skill. I mean, this is what makes an ordinary clinician different from an accomplished clinician. So what I wanted to tell is this process of thinking should start. Although in the beginning, our predictions may not be correct, we need not worry about it. But if this habit happens, and for that, a protocol will be helpful. for youngsters. It is like, when you are first writing on a paper, you need lines. Afterwards, you can write on a blank paper. So that transition will definitely happen. So I think a protocol will definitely help in young physicians to develop this thought process and refine it. So I think this was your first question. The second question is really very important. I agree. I want to bring your attention to a discussion in Ashtanga Hridayam Uttarasthanam, where Vagbada is telling, Ka nirmantre edad brahma bhashadam brahmajova, Ka nirmantre vaktur bhedokti shakti. Let Brahma say this, or let Brahma's son say this. Haridagi will cause Anilomanitvam is a fact. It doesn't matter whether Brahma says or Brahma's son says. And then he uses a term, nirmantre. Nirmantre vaktur bhedokti shakti. So Vagbhada is dividing the entire clinical intervention into samantra and nirmantra. It's only in one place he mentions it. And so he says, when the samantra element is involved, who does the treatment is important. When the nirmantra aspect is involved, it doesn't matter who does the treatment. So it is only through a lot of self-discipline. So Ayurveda had given a relevance to that dimension also. All this comes in the process of tarka of siddhi, of clinical success. To even understand that your treatment is working through the samantra mode, where, because of the connection, deeper connection between the physician and the patient. In my opinion, you begin your career as a bhishak. Then you become a chikitsaka. You are just a physician who is just giving medicines. Your treatment is working only on the basis of medicines. Later, when you become successful, you begin to develop the confidence of the patient. Roga bhayam haradi idi bhishak. Second stage, you become a bhishak. Third stage, you become a vaidya. Vaidya is one who knows the sukha dukha, the vedana, tattva vedana, vaidya. And in the fourth stage, you become a pranabhisara. You become a friend of the prana of the patient. You are not dealing with the patient from the outside. Jnana buddhi pradivena yona vishadi yogavit advirasya andaratmanam nasa rogam sigilsadi. When you evolve into that stage, you become a pranabhisara. And in a pranabhisara stage, your treatment is not just nirmantra. It becomes a samantra. And in that state, even seeing the physician is enough for healing to happen. Now, instead of treating, you have become a healer. So this is a roadmap for the development of Ayurveda. And here also I want to tell you that this clarity of mind, what makes you a samantra person, what makes you a healer, is clarity, lack of bias, lack of sattva, tamas and rajas. A preponderance of sattva is what brings in that quality of, samantra physician in you. And for that, beginning with this approach, I think is the best way, because this makes us very unbiased, very clear in our mind. And with that clarity and purity of mind, as we move forward, I'm sure that we will develop into a very accomplished physician who does not depend only on, external tools like medicines to bring about a treatment. So it was a very, very important and interesting question. I hope I was able to clarify, what question you had in mind. Dr. Ramya?
Yes, sir. Thank you. Thank you, sir.
Next question. If there is no more questions, then I think we can go for the vote of thanks. But before that, I would like to ask Ramji one more thing. As you mentioned, the hierarchy of progression as a clinician to a pranabhisara. Yeah, from a chikilsaka to pranabhisara. If that is the case, so when we go through the Chikitsa Sthana itself, we have many formulas, or also might have these type of dimensions. Is it not? Is it not that this yoga what we have in the chapter? Sometimes we can see some yoga mentioned as Siddhavat. Siddha, it is very Siddha. It is highly effective like that. Maybe there are even in the yogas we have these type of what do you say, super yoga? I mean, something like that.
I don't know, because the word Siddhi and Siddhatama used in the context of yogas seems to be related to the idea of Siddhi, that it gives an outcome, a very good outcome. Siddhatamatvam means in that particular condition, as I was smelling. Another word which Charaga uses is Kantatamatvam, Kantatama. So there was this system of finding out for a particular dosha vigalpa in a particular dhadugada avastha, which is the Siddhatama yoga. So they were looking at, so I think the dravyas, of course, when it is wielded by a physician who is more evolved, who has more, access to the pranic energy, the whole yoga may work in a very different way. We also have the concept of Divya Ushadis, that is very specially mentioned. So those, they may be sources of higher pranic energy also, apart from just being, based on chemical medicine. But they come, and whenever such things come, I think we convert them into Deva Vipasaraya Chikitsa, and we are not putting it under Yukti Vipasaraya Chikitsa anymore. So today's discussion was predominantly on Yukti Vipasaraya Chikitsa, where Siddhir Yukta Upradishthita, Matra Kalasraya Yukti. So, because that is a starting point. The other things is like, every physician may not be able to evolve into a Pradabhisara. So the texts kept it open, because by the individual tapas of that person, whether they spend enough time with good accomplished physicians, they may evolve into such a higher physicians. But I think the starting point, if we start our journey focused on Yukti Vipasara very clearly, I think that mental purity will come, and gradually we will be able to go higher. And definitely, as you said, it's true, the Divya Ushadis are there. Some of these yogas may have medicinal plants which are very powerful, but I think the majority of the yogas that we have mentioned are supposed to be used on the basis of proper Yukti.
Thank you, Ramji. Now, of course, we don't have any words to say about your wonderful oration, but as a part of our formality, I invite the State Treasurer of PACTO, Dr. Vinita, to say a word of thanks in this occasion.
Hello, good evening, sir. Am I audible? Hello?
Yes.
Please.
Respected dignitaries present in the webinar and my dear colleagues, I have been assigned to deliver the vote of thanks of today's session. Before entering to that, I would like to congratulate the organizers, that is the team Ashtanga Ayurveda Vidyapeetham and PACTO, Private Ayurveda College Teachers Organization, for organizing such a series called Gurumugham, which is intended to share knowledge and thoughts among Ayurveda fraternity. Today, we had a detailed session of Pradinimigi Siddhi, what success means in clinical practice, delivered by our Reverend Speaker, Dr. Manohar sir. Getting deep in the Shastra, how beautifully he had elicited methods to define the outcome, and how revolution can be brought about to make Ayurveda more credible. It gives us immense pleasure on attending such a wonderful and enlightening session. I take this opportunity to thank you, sir. Thank you, Ram Manohar, sir. Next, I would like to thank Dr. Narayanan Nambi, sir, Principal, Ashtanga Ayurveda Vidyapeetham, for giving welcome speech and an excellent introduction to our speaker. And of course, you are the backbone of this presentation series. And now I welcome Dr. Binoy Bhaskar sir, who is HOD and Vice Principal of Maulika Siddhanta Department, Nangelil Ayurveda Medical College, Kodamangalam. He had given how keen he had been in attending the class. We had seen that, and at the last, not the least, I thank one and all our colleagues, our seniors and colleagues that who attended this seminar and actively participated in this interaction session. I wish you all a nice week ahead, awaiting for our next class. Thank you. Thank you.
Thank you, Ramji. Thank you, one and all.
Thank you. Thank you. Thank you.